Did you recently just have ACL reconstruction surgery and you're wondering how long is this pain going to last for? We're going to talk about why you're having this postoperative pain and how long it could last for and what are some of the reasons behind it. My name is Dr. Marco Lopez, doctor of physical therapy and certified strength and conditioning specialist and co-founder of the Basketball Doctors. All right, guys, let's jump into that postoperative pain. So when we talk about postoperative pain, it's a little different than regular pain after ACL surgery because some people might have pain around their kneecap several months after ACL reconstruction surgery, but we're talking about immediately the first month after ACL surgery, following that surgery. And we're talking about several reasons why you're having that general pain in your knee early on, in which people always say like, how long is this going to last for? Or I can't take this anymore, but it's usually short-lived, and we're going to talk about some of the things that influence that pain. All right, guys, so the first reason why you're having this postoperative pain, it all comes down to before you even had the surgery, your prehab stage. So before you have surgery, you want to go through a phase called prehab, and we have a video in our description below that talks more about prehab before having surgery. But the main goals before you have surgery, ACL surgery specifically, is you want to get your range of motion back, you want to decrease your swelling and get your walking back and start activating your quad. But the biggest thing is all these factors influence the knee, and you want to have what I call a quiet knee, meaning a knee that doesn't have swelling, has good range of motion, and you have good activation before you have ACL surgery. The reason behind that is because they've shown studies that the more prehab you do before the surgery, the easier the recovery and the better the outcomes. So that goes with the pain as well. If your knee is swollen before you even have surgery, going into surgery, your knee's swollen. After surgery, it's going to be even more swollen. And if it was painful before surgery, it's probably still going to be painful right after surgery. So those are some of the things that influence before you even have surgery, the pain that you have following surgery. So that's the first reason, which dates back before you even have surgery. So now the second one is also kind of before you have surgery. It's choosing the graft choice. So if you have an autograft, you're expected to have more pain than an allograft. The reason why is the autograft, you're going to get a graft from your own body. So either your patellar tendon, your quad tendon, your hamstring. An allograft comes from a cadaver. So there's not that site pain where normally you have when they gift that graft. So especially with the patellar tendon, they're going to get a piece of your bone, your patellar bone, and that's very painful. So depending on the graft you have, it's probably going to influence how much pain you have following surgery. And we have a great video on different graft choices and the pros and cons on each one. So click the description below. We have a great video on that. But the main thing is if you choose an autograft, especially the patellar bone, the patellar tendon one, you're going to have more pain than an allograft person, because the person with allograft won't have that pain where you got that graft from your patellar tendon. So that's going to influence how long that pain you have following surgery. All right, guys, now that we just talked about the graft choices, another one is the other injuries / procedures that occur during ACL injury. So a lot of the times that ACL tear is not just isolated, there's something that accompanies to it. A meniscus tear, an MCL injury, or a bone bruise. All these things influence your postoperative pain. So if you had a bone bruise, you're probably going to have more pain after surgery than someone that didn't have a bone bruise. Also, if you had a meniscus tear, that's also going to affect your postoperative pain because it's going to affect what procedures they do. So you might have a meniscectomy or a meniscus repair. So all these little factors affect your postoperative pain. So someone that just had an isolated ACL tear will probably have less pain than someone that had an ACL tear with a meniscus tear and also a bone bruise. Usually from my experiences, people that have the bone bruise have pain the longest after ACL surgery because you fix the ligament that's torn, but the bones that hit each other and that cause initial swelling inside the bones, it's still there for a while, and that lasts even after surgery. So bone bruises are a big thing to look at. But the big thing, like I mentioned, the other procedures and injuries affect your postoperative pain. All right, guys, so the previous reasons are just all before surgery or right during the surgery. This big one is postoperative. Are you having too much swelling? When people have too much swelling in their knee, that's just going to cause more pain in the knee itself. And that swelling, or that increase in swelling, is sometimes as a result from the actual surgery. You just kind of respond with too much swelling, or you may be doing too much too soon. So making sure you're not doing too much too soon, that's causing that swelling, which is going to affect your post-operative pain. Another thing is, if you're doing all the right things, your swelling's down or your swelling just keeps increasing, we also have to explore the idea of potential post-operative complications such as an infection or a graft rejection, which are very, very low, but there's something you always have to look at in case you're doing all the right things and you're still having pain there. That could be something to look at, or potential cyclops lesion, other little things there. But those are the bottom of the list. The big things that we see that are the main drivers of post-operative pain is, one, what did you do beforehand? How was your knee before you went into surgery? Were you able to get that quiet knee before you had that surgery? The second one is, what kind of graft did you use? Did you use an autograft versus an allograft? That's a huge influence on your pain. Another one is, what other injury did you have? Did you have just an isolated ACL versus a bone bruise, MCL, meniscus? So that always plays a role. And also, like I mentioned, what you're doing after surgery. But those are some of the reasons why athletes and our clients have some of that post-operative pain. That's what we kind of go over with them before they have surgery and during the surgical process. But just know this pain is usually short-lived. This is just initial. But if you guys have any questions regarding some of the reasons we explained why you're having pain following surgery from the post-operative side, comment below. We'll try to go into more detail, and we'll kind of go into things that we would recommend to avoid that pain or to minimize that pain as much as we can. But if you guys have any questions, feel free to comment below. Share this video with friends and family and other people that have had ACL reconstruction surgery. Hit the like button and subscribe to our channel. We are the Basketball Doctors. Let's ball for life.